Gets.
Yeah, so I didn't make a big introduction to our foot nerd community or anything, but I guess what I will say is that we're here, we, meaning me, are here with you to talk about your experience in HealthKits, which is really important to me to hear about. And I think that I'm probably not the only one. So from a foot nerd standpoint, who just finished going through the kit myself, I'm doing it from the foot nerd training respect though. So it's a little bit different, but the screens and all the content is the same. And so I'm here personally because I'm so curious from my own standpoint, and then just from, well, that's the truth. Like, right now I don't really care about the foot nerd program so much about, like, I want to know personally, foot nerds to foot nerds, like, what did you do and what was it like? And I don't know if you saw my big list of questions.
We did. Gave him a good read. Somewhat prepared.
Well, and I think I just was like brain dumping questions because I haven't talked to anybody who has gone through completely yet, or who documented, or who did it as two partners. And so this is
bringing
like
a few aspects for you, hey, Ruth. We're covering a few bases in one go.
Yeah, we are in one go. So how do you want to start?
Oh, I mean, you had a whole host of questions. You could probably start. They seem somewhat in order. We sort of ran through them as they were there, and seemed like they flowed pretty well.
I'm going to pull up my list, and then so maybe we can just go through. And then Nick asked me to gave me a good question to ask you, which I'll save for the end.
Oh, good.
Okay.
And I was thinking we would probably go about 30 minutes. Does that work for you?
Perfect.
Sounds good.
Okay, so let's just start from the very top. And maybe we'll just, I know a lot about Tom, but I don't know a lot about Zoe. So we're just going to go with ladies first.
Okay.
Always go ladies first.
Ladies first. So Zoe, well, first of all, just what is a little bit about your background and why you wanted to do this, and then your favorite part?
Yeah, of course. Well, I work as a radiographer at the moment.
Okay.
I guess I have some understanding of anatomy and health in general.
Mm-hmm.
But yeah, I guess Tom was a big influence, obviously. That's why I wanted to do it. And I never really realized how not flexible my ankles are. We were doing the needle wall one day, and I was like, oh wow, quite stiff. Like, I think it started at 4 or 5 centimeters, dorsiflexion. So yes, I guess that was a big thing for me. I was like, oh, I realized that it was really restricting a lot of my movements, like squats. Like I can't, I gotten better, but my squat, like I'm not able to go all the way down without coming forward. And throughout, I guess I saw an improvement in that. So yeah, I guess that was a big motivator at the start. Not being able to have that huge range of dorsiflexion.
What kind of shoes do you wear on a daily basis at your work?
She wears good ones now, Ruth.
I know she does. What did you used to wear, Danskos?
What's that? Sorry.
What kind of shoes did you used to wear before you met Tom?
Just regular shoes like Nikes, and I did have a lot of problems with sore backs, and I think that was because of the elevation in the heel. But yeah, the favorite part, I guess, was just seeing the changes like so quickly. Like you'd do a few exercises and then you'd retest like a few experiments and then retest, and you'll be like, oh wow, like that made a huge difference, like, especially in the needle wall for me, because that was something that was so stiff at the start. And it was quick as well. Like, you could do it for a couple of days and then you'd be like, oh, okay. And we were recording the sessions as well, so we would see the progress on film, which was cool, and the numbers on the ruler for the needle wall, which was nice. But yeah, I think that was probably
when you recorded your did you record your sessions as well as your screens, or just your weekly screens?
I think we did it all, didn't we?
Yeah, often trying to capture enough like the content that we're posting each week with James. So it was sort of, we would film a little bit of each session, or if I had done say 4 or 5 film sessions, because it really took up the space on my phone when you have 20 to 30 minute sessions of film. So you just skip a day or so. But we recorded, I'd reckon across the time, at least 60 to 70% of it pretty consistently, just to get like the content for it.
Yeah.
Okay. You didn't happen to save it on YouTube, did you?
Did not save it on YouTube. It would probably be hidden within my Google photos somewhere, most of it, because I had to delete it off my phone and my Apple photo. But because I save everything to the cloud, so it should theoretically still be in my Google somewhere. The first
I don't
ones.
know. I'm just brainstorming here, and I don't want to make any extra work for you, but if you come across that and you wanted me to upload it to YouTube, because I think I have a sneaking suspicion that whatever you guys did together is an important cheat code for dorsiflexion.
I saw that in the questions.
Yeah. And maybe we can talk about that a little bit later, but just as a little bit of history. So some of us who just finished with the 6 weeks, also me, I'm particularly interested because I mean, I have some other issues going on, old injury wise and stuff, but I still I was so surprised that I think, what were your end measurements, Zoe? If we went from 4.5 to.
It was about 8 centimeters on each. Yeah.
You're just killing me. I mean, that's so, and then Tom, yours wasn't yours like 7 to 12 or something?
Yeah. So mine, like my first one, the way I measured it was 4 centimeters at the first point, and the first range was like when I first felt a pinch in the front of my ankle. And then I think I could get about somewhere between 9 to 11 fully, but it was pinching the whole way through. So by the end of the cold range was no pinch up to 12 centimeters.
But still, that's so great. So I was at like 5.5 on one, 6.5 on the other. Both were like, it was a little bit different feeling if I was like kind of pushing from a low lunge position or if I was standing, right? So, but then then I improved, and then there's like a difference, like when you're pushing and you have the limitations or the restrictions. But then so I had a little bit of a setback, and then I'm kind of, the progress is intangible. There is progress, but it's not 5 centimeters or 4 centimeters. And that is why I'm here to research and discuss.
You need a thumb.
Yes. So that's why I'm here to interview, because I want to take the information back to the masses.
Yeah.
Well, we can try and help the masses. I can try to explain the fun process there.
I appreciate that. And then one thing we're going to change in the foot nerd training aspect is incorporating like posting the video content to Slack for foot nerds. So so as baseline data, we're able to watch each other. Like I just would have given anything to see you doing what you're doing as I was going along. As it stands, I'm going to do the whole thing over and try again.
Yeah. That I can help with. I think that's not. The good part is obviously being a physio and a foot nerd. I have a thorough-ish understanding of how to do it. So the experiments as they were laid out, some of them we used from the program, and others were manipulating different positions with sort of different exercises to really get the changes that we needed, which was useful. So there'll be more like those ones. I mean, we were talking to Nick yesterday, so we'll upload and film a few of the extra ones in the coming weeks anyway. So there should be more experiments at some point within the program, which will be
agreed. And then what about you, Tom? What was your favorite part?
My favorite part was getting rid of the pinch in the front of my ankle.
And it's just gone, completely gone.
Yeah, so it's not there anymore. It only comes like as a restriction across the front of the ankle now at the end of range, versus like every time my knee going forward feeling a pinch. And there was like a second sensation that I didn't really bother documenting, which came more around like my medial arch, which no longer there either, which is nice.
Same foot or opposite foot?
Same foot.
Okay.
Yeah. So like, but both of mine have had different sort of responses. My left one had the pinch. My right one is more limited by my knee. So if I warm my leg up on the right side, I can get a needle wall of 20 something, like just on
20 centimeters?
Yeah. Yeah.
Whatever.
Yeah.
I know, right? It's not fair.
Hard work, Ruth. It's all in the
Not
work.
fair.
But yeah, so there's still like a difference in terms of what limits it. It's more of a sort of a joint limitation on my right one. So it's that, again, it's just going to take time with its loading. Yeah, on the other side. No, yeah,
And
I think it's progress. It's time.
And I remember that, Tom, you had previous injuries from.
Oh, so many.
And Zoe, did you have any injuries when you started, or?
No, nothing major.
One sprained ankle.
Yeah, a couple of sprained ankles playing hiking and playing sport, but no major injuries.
Congratulations, by the way, to both of you.
No.
Thanks.
Okay, so.
Oh, yeah.
So the next question is, and we start with Zoe. What was your biggest takeaway?
Oh, biggest takeaway. I guess just learning about like playing with the different movements. Like using them, but not being so restrictive, like, getting into the position and just play, like there's no right or wrong way to do it. Mm-hmm. And to see what feels right for you, I suppose.
Did you use music?
We really did we?
No, not really. We were mostly just talking.
Yeah,
the whole time.
just talking. Tom would give me cues, which is nice. But yeah, Tom and I would do different sort of exercises that probably helped us differently. Like so yeah, it was just working out what works best for me, and then obviously doing the reassessment and seeing what was best. That was probably the most, being playful in the positions and trying to work out. Yeah.
Playful is good, Zoe.
It is. I'm learning.
I'm learning too. And then how about you, Tom?
I think, and I honestly, I think if you ask James the same thing, he'll say the same answer, that showing up consistently to deal with a problem that has probably been lingering there for quite a while, but obviously being able to function around it. If you do the thing that you after experimenting figure out it's going to help, do it repetitively and you will see a change. And it doesn't mean that's the only exercise or exercise grouping that will help you for the rest of your life. But if you do it, 42 days is, that's a fair few number of weeks to repeat something. You should, by physiological standards, see a change, and it works, which is perfect.
For sure.
Mm-hmm.
The idea of showing up consistently, right? Like that's one of the biggest complaints that everybody has is like, I know what to do, I just don't do it.
Yeah.
Right. Yeah. So like you have the information, but you don't use it. And so this is a little bit of
information fallacy.
Exactly.
Yeah. It's easy when you can see the result though, isn't it? You get that motivation. And
you sure do. Like when you just, even if you feel just a little bit less smidge, like I'm talking about, I'm disappointed about dorsiflexion, but I honestly don't care about dorsiflexion. I care about the big picture. And dorsiflexion, like I have that right pinching in the lateral part of my ankle, a little impingement feeling, but there are so many intangibles. I think the efficacy or the efficiency with, like you said, spending 42 days doing something and honing in on something consistent that works, right? Like the feedback that I got from another nerd, which I think is true for many of us, is that, we don't have like the experience of like the physical therapist in order to kind of triage, even though we're learning through the lessons, right? Like we're being taught through really good lessons, but a few of us were talking about how we would just, we would try things and then we wouldn't stay consistent. Like, so almost like the first 6 weeks was a little bit of a beta test for me. And now I'm going to do it again, but I'm still unsure of like what I should consistently do. So
I think that having the framework, which is something hopefully we can set out for version 4 of, like, if you're trying to improve X, which is going to be dorsiflexion, understanding the different approaches or the different things that you can like tackle that problem with. And like you said, dorsiflexion is not necessarily the end all be all. Being able to do the squat or jumping or the playful activity is far more important than dorsiflexion. Right. But if you know what you're trying to break down, and then at least you have the framework of, if I try this one, or this one of those is likely to help, because there's only a set number of things that are going to limit dorsiflexion. And if you understand most of those variables, you can then have more guided success, because it's the same as a physical therapist. The easiest way to get people to be compliant and be motivated, particularly in the first 1 to 2 weeks, is you have a problem, you assess the problem, you do something and reassess, and you want to feel and see the change, and it can be instantaneous. And doesn't mean you're going to wake up and it's still going to be there, but you need that spark, because otherwise it's very demotivating. And it's understandable, particularly when you don't have the background to trust that 6 weeks of this is going to work, because you don't know anything different.
Right. And then so I think many of us latch on to dorsiflexion because it's a tangible number, right? Like we know that know that we have a goal of double digits, which if we could get our knees out over our toes and our center of gravity pulled forward a little bit, we could sit in that resting squat for the 60 seconds plus. So I think that's why so many of us are kind of focused on the numbers, because we know that that's going to help us shift our weight and such. So what was the hardest part, Zoe?
The hardest part for us, probably just finding the time to fit into our schedule was difficult, because we have a morning routine which we sort of do gym and walk and whatnot before work, and then coming home late from work as well sometimes, and we do a bit of running and too many things, or lots of things which we enjoy, which is nice. But just finding time to fit it in, like every day, and making sure we turn up to do it was probably, and because like Tom was working a bit later, made it a bit trickier. So just finding that time, it wasn't quite possible to sort of schedule it in for the same time every day, because work schedules change and things come up, and we also prioritize sleep.
Sleep's number one.
Sleep is number one.
Just finding that time to slot it in.
Did it start to become a little bit of a grind after a while? Like, I mean, so the reason why I'm asking this is that for me, I created like a little chart that had handwritten feet, and I would color it in, like tiny habits idea. And right about week 5.5, I was like, I'm over this. I'm done. I don't care. And so it was like, I mean, I still did it, or sometimes I would kind of half do it. And then I didn't rescreen on my 5th week. So I skipped one day because I was filming everything, and this is my life and I really enjoy this. So I was just, I know I'm curious, like, you have the person next to you, it's fun to have a buddy, and you have an accountability buddy as well. Did you skip days, and then did it become a grind, and could you do it on your own, or would you do it on your own as successfully?
As I said, that lists a few of your questions together. We thought about in the car, it all came in beautifully.
We probably, like, having each other was great. Obviously having a Tom was amazing. I wouldn't the exercises and like the cues which he gave me were amazing, but the time, like having with Tom's work schedule, we probably would have done it, wouldn't have skipped as many days if we had done it separately, because it's just aligning our schedules and timetables.
Oh, that's interesting. Wait, so if you were doing it individually, you would have completed more days than trying to figure out your schedule.
Probably. That seems to be the gut feel.
Interesting.
Like Tom was working 8 till 6:30, so
6:40. So by the time I got home, it makes it
does make a difference.
And we go to bed at 7:30,
normally. So you don't have a great deal of time in the evenings to do it. So you have to push back the sleeping to then fit it in on those days. And some days I'd get home earlier because I wouldn't have a client in that, like the last 1 or 2 slots, which was super easy. Just like, all right, come home, get that done pretty quick. But it also meant that when Zoe finished at 3:30, she has 3 hours where she could have done it, but because she's waiting for me, does other stuff, totally good. Yeah. But then it's like, oh, how motivated are we to do it before bed? You know, particularly knowing it's going to take 30 odd minutes or so, which can be challenging.
It worked both ways though. Like we were, motivating each other to do it as well. But there was a few times.
I don't know about you, but I found that it's tougher to do in the evening for me. Like where I just would, even if I did it, I just wasn't quite as focused, or I would be watching tennis and on the beam, or I would just kind of like not give it the full attention as if when I was doing it at my peak hours in the morning.
Yeah,
definitely.
Absolutely. Yeah.
I didn't expect that answer though. I thought for sure that it was easy, that you would have, that you wouldn't have. Now I understand. Like if I was trying to coordinate with my husband, I think I would miss more too.
That was the strange part when we said it. When we read the question, that our first instinct was to say, oh, no, it would have been easier doing it together. And then when you really think about it, it was like, no, because we're pretty good with scheduling in our like individual lives. So it's like, if it's locked in, it's like, all right, we'll do that then. But for Zoe to do it at say 4, and then for me to come home and then do it, it didn't really work, because you're not spending that time together. I have to take a half hour out of doing what sitting on the couch or talking to then just do this thing while she's already done it. And it was a bit of friction. Would have been like too much of a barrier to do it that way.
Brilliant. That is really interesting.
Yeah.
Okay. So my next question is I guess before I ask you this question, there was something that was pressing in my mind just 1 second ago to ask you, but it'll come back. The hardest part, scheduling.
You can see the brain ticking over.
I know. Okay, forget it. What is your advice for others going through the 42 days? Like if you had to give your one piece of wisdom and nugget to somebody who is just starting, based on what your experience, what would you say?
No, you go first. Do you have anything?
Let me have a think.
Got 2 nuggets really.
Okay.
So one is, I think you'll find it's very easy to maintain consistency with the lessons up until about the end of week 3, because there's essentially 3 weeks worth of lessons. So knowing that you have your starting point to your day of that is watching the lesson, and that's really easy. That's the prompt that's going to help you get up and go do whatever you need to do. So that, I think the first 3 weeks are pretty, the next 3 where it's a bit more free range and you've got to, be a little bit more onto yourself. Probably best to try and habit stack that in somewhere at the start. Like take the idea that I need to do this at some point. So I'm going to really have that intention of I'm going to do it after whatever other activity it is in your day. So you actually get it done. I think that's the biggest thing, because we did that essentially. And yes, we missed days, but it's kind of, as you know, from trying to habits, like if you miss a day, it's fine. If you do it the next day, then that's still, you're coming back and doing it. It's just not skipping 2, then 3, then 4 days, and then coming back and then feeling almost ashamed of yourself for missing.
Exactly.
Like, it's all right. Life happens. I missed a day, but I have, yes, it's 6 weeks, but this is an ankle journey for the rest of your life. So don't get caught up in that. But I think that idea is probably the biggest thing I would say is my nugget.
That's a good nugget. And you're 17 hours in the future. So you're like giving us the future. Footnote, this is your future.
Yeah, exactly.
Future Tom is here.
Exactly. No, but that is so good, because it helped, because that is a good nugget of advice, because that's something that a person couldn't really know, right? That you're going to go 3 weeks in, and that's probably going to be around the time where you're going to be demotivated, where you start to feel that web-like of confusion, like where do I go and what do I do and how should I design it? And yet the idea is to empower ourselves, like use the information to take responsibility, right, for doing the thing on your own, which is really hard even when you have all the information, to create it.
Because it's set out like as in the PDF. So we followed the PDF to try and do it as to the letter as it was written, like day 1, do those 3 things, or day 2, do those 3 things. And just, again, we follow that all through. But once you get to that next bit, you then have to be more self-critical. Like, which ones actually helped me? Did I complete all the experiments like I could have? Which ones helped me the most? And then take that data to then implement for the next 3 weeks. And if that first 3 weeks doesn't have the clarity of, I did the beam and my dorsiflexion balance improved by X, you're not going to be able to make a better informed decision for the next 3 weeks by yourself, particularly if you come from like a non-physical therapist background and don't have that framework to function off. So I think the first 3 weeks are very important with how you follow the next 3 weeks up.
Yeah.
Good nuggets. Okay, so then I'm going to ask you Nick's question, and then maybe we can dive into a little more of the details of my personal interest questions.
Next question.
Yeah, Nick's question was, please ask them if they would you, and this you have to be willing to be completely honest, would you recommend this health kit to others, family, friends, or peers? And if so, why? And if not, why? And I'll start. I actually had to unpack this question myself. And granted, there's like some difference. I mean, I've been through the health kit alone, and now I'm doing foot nerd training, which has aspects of the health kit in it. So when I went through the health kit, I would say, I have to say, like, I haven't recommended it to anybody. Like I haven't yet. So my question to myself is, why haven't I? And I guess my answer to that would be, I haven't because I don't think I have had enough personal success. And this is my job, by the way, so if I want to recommend this to my mom and I haven't even had like the success that I want to have yet, I don't feel confident yet, to say that, like, is this framework something that she could follow and it will be immediately helpful?
Yeah.
Even though like everybody going through it has great things to say in the sense of like, certain things are resolving or they're learning, but to my own family members, it's going to be a shit show. They're going to be like, I don't understand.
Yeah.
And then, so that's been my experience so far. And I didn't even realize that was a question I had, I hadn't answered. So that's to answer Nick's question from my perspective. How about you?
Yeah.
You want to go first or me go first?
Yeah, I'll try and answer it. I mean, my first instinct was, I would recommend it. Just because it's got like a lot of just like the barefoot walking, like just any sort of knowledge, I think is great for if I'm thinking about recommending it to my family or friends. But then totally resonated when you said, they wouldn't understand like a lot of things, that it would just go over their head. I was lucky to have Tom to explain them to me. But yeah, I think it's a good baseline knowledge of stuff to begin with. But then going forward, I think they'd need a bit more direction and help from the PDF, I suppose, a bit more.
Yeah, it seems like we talk about having a Tom, now Tom, having a Tom is like having a practitioner, a physical therapist. That's going to be my new, that's going to be my new nickname for a leader, a guy, having a health guide, right?
Yeah.
Tom. So like, I guess what we're saying is, if you don't have a Tom, you could fall away because it's not,
absolutely,
it's not clear.
Definitely.
Okay.
I think that's it. So like when we were speaking to Nick yesterday, we talked about all sorts of stuff, but I would have to say yes and no, because I think the no part first is, I don't think that it's clear enough kind of to what the point about dorsiflexion, like there's experiments in there and they're all great exercises, but all exercises are essentially really good. If you don't know which ones you're trying to target for your particular problem, it can become quite challenging because you aren't, to your point, not feeling successful. And even though I know you rolling on the ball, then doing a single leg thing and then getting on the beam, if you repeat that, you're going to get better at other aspects of your life and your physical movement. That's not the reason you're there. So in that sense, it's not going to resonate the way that we would like it to yet. Right?
Exactly.
But I would say yes, because the tool itself is evolving, and your input to it is as valuable as anything, right? You as a person doing it. So go through and go, God, doesn't make sense. That's good data. And knowing that you've paid X amount of money for it, you might feel a little bit gypped, but every time that thing goes to version 4, 5, 6, as it goes on, you're going to get a better product going through. And whilst it might not make sense yet, version 4 will probably be a whole new game. By version 5, it'll be an entirely different system. Like it's going to be far better. And with the things that we want to implement within it without drastically overhauling it, I think you will find by that point, if you have a dorsiflexion limitation, you will know more sort of succinctly which experiments that you could try first. So you go, I'm going to try one of those 5. Oh, that one worked. Okay, so I might need to fix my tibial internal rotation, not just drive my knee forward or like whatever it is. And that sort of extra guidance, particularly in the first couple of weeks, I think you will find that will resonate more. So no, at the current juncture, but yes, in the fact that it's going to keep building across time.
Yeah, that makes sense. I was dreaming, like I was thinking like from like a patient perspective, right? I was dreaming because I was like, well, from the screens that I've done so far, I can tell my limitation is dorsiflexion and external hip rotation, judging from the screens, because internal rotation from this set of screens appears to be, functional, and my hip flexion is fine, according to that screen, whatever the nuance, there are different nuances. And so I was like, what I'm dreaming of right now is just a list of what I should do for the next 6 weeks, because I have these 2 things as limiting factors. Yeah. And then like my cohort has awesome, hip extension and perfectly fine, internal rotation, and their main limiting factor would be like external or tight hip external rotators and mobility. Yeah. So then there would be a list of things that you would do just for that. Yeah. And then you wouldn't have to then think like, oh, but I'm going to try this today, or this is really not fun. I'm not doing that because I freaking hate that exercise. Yeah. So stuff like that. But
and that's part of what we talked about, and also in the long run, however, we don't know how to implement it on there yet, but having here are the ones that we recommend for the problem per se, given by like, the data that we've collected throughout the group, but then have it as like a voting up system, kind of like on Reddit. Like if someone finds this useful for their tool, vote it up. So by the time it goes, you've got a list of ones that are recommended, but a community driven, like every time I do this one, it seems to be good. And then it can be prioritized going down the list, because again, the one at the bottom of the list will help someone. But if this one's the major one, then that's driven by the people who have done it, which also means you feel included because you've helped propagate the idea.
That is brilliant, because I was like, wow, what we really need here is like a study. We need to be collecting data for what's working with people. And that's exactly what that does.
Thank Nick for that idea. He said it yesterday. I thought it was genius.
He is genius. Like he has that. He's a good synthesizer. He knows how to take all the input and then be like, let's do this one thing. And you're like, yes, I've said 1,000 words and he fixed it in one sentence.
Yeah. I love that.
Okay. So, so can we just get in quickly? I know I said only 30 minutes, but I'm just going to go through my list today. And I don't care about how you felt emotionally. I just want the cheat codes.
Give me the cheat code.
Okay, no, seriously though, my last question for the day is, what the hell did you do consistently so I can replicate it and try
it? Okay, I'll try and break this down in the simple sense.
And if you can't break it down, let's find the videos on the iCloud. I'll load them up to YouTube, and I'll just follow what you guys did.
Definitely not too hard to follow. It's just there's a nuance to some of the efforts, but I'll say that. So when you look at dorsiflexion, that's your knee going forward over your ankle.
Yeah.
So we have to think of all the things that could potentially limit that. So if we just start from the top and go down, if your knee is going forward, because gravity is going to keep coming down, your quad has to be able to work eccentrically to help control that sort of motion. So one of the first things is, do you have the control and length/strength through your quadricep?
Yes, right? I do.
Secondly,
okay, and but let me tell you how I did it, because we're talking about me now.
Yeah, good. I like it.
Just kidding. I was doing like I would do couch stretch as like a prehab, and then I would do like, that knees over toe guys where you like you lean back in that couch stretch position essentially, and then I pull myself up.
Perfect.
And I could probably go to like 45 degrees. It got better throughout the 6 weeks too. That was one of my experiments.
Yeah, not perfect. So that's a great sort of double bunch of exercises there, because you want that length and strength, and whether it's the reverse Nordic, which is what you're talking about going backwards, or it's what
reverse Nordic.
That the Patrick step or the Pollock step, where you step down and your knee goes forward, that's going to start to build that strength. So that's some aspect of that is important. And then the next part down the chain is going to be the muscles on the back of the legs, so your gastrog and your soleus, particularly that soleus muscle. It has to help control going down. So this is one of the ones where people often have problems. So if you do the Patrick step, you're going to get both those together. That's why it's such a useful exercise.
Mm-hmm.
But if you can't do that, you have to find a way to have, if that's your foot flat and that's your knee here, that's not doing anything. But if I lift my heel up, now all of a sudden gravity is trying to drop my heel and I'm pressing down. So now my calf is learning to work at length, particularly the soleus, because my knee's still bent. So it's like doing like the long lunge that he does essentially.
Yeah.
And holding those postures. Yeah. If you can hold those postures, and often for those sorts of things before the reps, and this is what I made Zoe do, it's all about holding and finding the spot that you're shaking, and look at it like a neurogenic shake, because your body always skip that section, particularly when you're doing like just normal motion, because it doesn't know how to work there. So essentially you find the weakest point and fix it. So you do that one and that one, they're very important. And then it comes down to like, well, what else actually crosses behind the back of the ankle? So we know you got your Achilles, but you've then got the 3 tendons that run up the inside. So your tib post, your flexor hallucis longus, and your flexor digitorum longus. And then on the outside, there's peroneals. And you have to make sure that this is what Zoe's saying with the sort of exploring. If I take my knee forward, that's cool. Well, my knee never just goes forward. It often goes off left or right. So you have to explore which angles you might be having problems with, because we need to figure out which of those tendons are particularly or not able to experience load at length.
Well, that requires a little bit of a different kind of screen, or a different type of paying attention as you're screening.
Yes.
Right. So like in our knee to wall screen, we say, make sure that the knee is tracking over the toe.
Yeah.
The second toe. But
yes.
Then when you're doing when you're so when you're screening, that's one thing, but when you're experimenting, if you're not paying attention to that, that's where the trouble can come, right?
Yes. So essentially, if you look at it like, to keep it safe, you sort of go knee straight forward over the second, third toe, then try and take it over the big toe, then over the 4th and 5th toe. Particularly the one going over the big toe is likely where you're going to have more of the problem, because you're going to find that and this leads into the next problem. When I do that, my tibia is going to go into a certain rotation, and you need an internal rotation to be able to dorsiflex. And you might find there's limitations there, and you might find it stiff under like the midfoot, and it's not able to drop down to sort of pronate to go flat to allow your knee to transfer forward as well. So you might have the calf strength and the quad strength, but if your ankle joint can't take on the load, your foot doesn't flatten, then you're not going to get that same thing. And by driving your knee over your big toe, you'll experience more of that load or that change. So
oh my God, I'm starting to sweat.
Yeah.
There's like
we're not even done yet. There's even more.
I know. Okay, but before we go on, do you guys mind having more of these conversations with me?
No, we can do that. They're fun.
God.
Yeah.
Are they? If they're fun, I would love to continue, because I think that this is like important information that other people could benefit from too, if they're like into the nuances, right? So like, if it's like the big picture where you're just trying to, I don't know, whatever it is you're trying to do. I wasn't successful with this part. It was
I think the big picture is like the fun and exciting part. And the reason that I like nuance is because of my injury history. That big picture stuff doesn't work because my body is my body. So I've had to get nuance to figure out oh, this angle does this, but if I move and lift my toe up here and do this, that's more of the feeling that I need to then affect the outcome. And you just, years of playing around with it, you figure them out. But now I've gone and done the back end stuff of, now I understand why it works and the structure to it.
There's something about impatience in there, right? So like, I definitely want to play tennis and I want to be pain free. But you're talking about back end stuff and patience and time and truly, paying attention to the detail, the magic of the details. And that is something I think that from my perspective, even though I live this every day, this job, and have the time for it and I can schedule it, I can imagine that it's hard for people who don't have a Tom and who don't have the time or the support to set aside and then to truly explore. So I guess like in a recording, if we were offering this to our TFC family, like what I would say is that it's super important to create enough time to play in the nuances and to get really cozy with the details, right? That's what we're talking about. Like, I have not been respectful of paying attention to the details. And I think that is, in addition to making a product like this better, I'm trying to kind of wrap this all into a conclusion so I can let you go about your day. Even though it's really fun talking to you, that I think if we could, you talk about version 4 and 5 and like having an evolving product that essentially you pay for once and you can have continual access to. And then on top of that, to learn how to, within our own bodies who are used to scrolling and having like attention distraction addiction, that we have to learn to get into the deep rewards of detailed work. That's what I see. That's what I think I see in both of you, and Tom, because you love movement and stuff, but like just enjoying the process of learning about the details just for the sake of learning. And then the byproduct is that you do actually improve. And having sports injuries, I think is, or any injury, not just sports related injuries, but is just such a huge, has a huge psychological impact when you have a setback, right? So like that Nick and I were talking in our meeting about playfulness and setbacks and how there are setbacks. Like even though my dorsiflexion didn't improve, I had other very subtle and intangible successes that improved my whole tennis game or just the way I move. And then with that newfound, that new level of success, I pushed a little too hard in a certain area and I had a setback. And then that kind of psychological fear comes back in, like, oh no, I effed it all up and I'm not going to get to play anymore and it hurts, and kind of bouncing back from that and then digging in again, right, is important.
I think that's one of the biggest lessons I think I have instilled upon Zoe across the last year of this movement journey is because I'm trying to do the splits and I'm trying to push boundaries of range. I'll often end up having some quite sore spot somewhere because of, I'm pushing it and watch me not hobble, but I'll be in pain for like a day or so. But the attitude's like, yeah, it'll be fine. Like that is what happens when you sometimes push the boundary. But I know through repetition and experience that it'll be okay because I know that pain's okay. It's not, pain isn't bad. It's just an experience. And I think that's the mindset that every time it hurts, historically, you would be like, oh, I've screwed it up or I've damaged something or I've done this wrong. It's like, no, your body has to learn how to experience that comfortably. And it takes time.
And so what was it? Were you worried for him sometimes? And then you realized.
I think she was ever worried for me.
No, he knows what he's doing. That I think more to the point, like I'm more aware that if, I've, done something in a gym, I'm sort of just aware it's just because I've moved differently, not because I'm hurt or like.
Right. Or that it's going to be life-sustaining injury or that you're going to have to get pain meds or something.
Yeah, exactly.
Or surgery. You don't have to have surgery. Don't worry.
No, none of that.
None of those surgeries. Not about them.
Okay. Well, is there anything else you want to add before we say our goodbyes and I say my thank yous?
feel free to ask me more questions. There's more to the dorsiflexion where that came from.
There's so much more. There's more.
Yeah.
What else okay, so maybe what I can do is I can kind of assimilate what we've talked about in the way of like specifics, and then I would really love to see your films and
see if I can locate some of the fun
parts. Or
yeah.
even if you don't want to send the films, just like a list of it, that like, how did you consistently design? So I know you had like a right ankle pinching, and Zoe, you were trying to increase dorsiflexion to get into a resting squat, right?
Yeah, exactly.
And then so you designed a system that was a little bit different for each of you, depending on what you were working on.
Differences. And like once we got to the end of that first 3 weeks, rather than doing the same exercise necessarily every day, because I get bored, day 1 and day 2, so targeting different things, so different aspects to both of those movements, using the same reassessment tools, but do 3 or 4 on day 1, day 2, and just keep repeating cycle.
And you have that documented somewhere? I'd like to just see the
photo of it.
Yeah, we would have a photo.
Yeah, because I wrote them all up on the whiteboard. Sure, we took a photo somewhere.
Yes, documentation without authorization.
Yeah.
Yeah.
I mean, it'll be somewhere, like the aspects to it.
Yeah.
Okay.
But even if I can't find the specific aspects, I can send you across like all of the things that you can probably assess to look at to figure out which part you need to do more of, because that's the underlying thing, right? Like trying to just improve dorsiflexion might be different for both of us, but if you test one of the 20 things I can list off to you, you could probably find out really quick which one works.
That'd be so great. I would love that so much. So I'm going to start again on October 1st with the new crew, and I'm going to take a different systematic approach, and I'm not going to stray from my plan, which means it has to be a very good plan.
All right. But essentially, I've got 2 weeks to send you some stuff. That's easy. Anytime.
Yes. Oh my gosh. Thank you so much. And you're okay if I share this with our TFC community?
Yeah, go for it. And if they feel like, particularly if it's in the Slack too, tell them to shoot me a message if they feel like they have any particular questions. We can do that.
Okay.
Help them out.
I will definitely do that, because yes, I definitely will. Zoe, and this was such a good opportunity to meet you. I mean, I knew I wanted to pick Tom's brain, but I was like, what I really want to do is talk to Zoe.
Beast. No, beast. I love that you called me a beast, though, Ruth. I don't think I've ever been called a beast before. So I love it.
So good. And yeah, I hope we get to talk more. Oh, I had one last question for you, and that is that when did you finish the HealthKit? The last day?
Oh, when did we go to
it was like the 6th of August.
Yeah, my birthday was on the 8th, and we went to New Zealand. So yeah,
we left for New
You
Zealand.
were a very good birthday fairy, Zoe, by the way.
Yeah.
Amazing.
Yeah. It was lots of fun.
Yeah, it would have been August, yeah.
Yeah.
So it's been over a month. And
Yeah.
and what are you still incorporating your 30 minutes of exercises every night, or?
God, no.
Yeah, no, like
well, no, because so the way it works, I do an assessment with Zoe every 4 to 6 weeks, just like a general physio checkup, and then I write her a program to do, which she then does. So she has exercises, which she does most days.
Yeah.
But they're incorporation of not just foot and ankle stuff. There's like back stuff and other like postures, but. So and like I'm still doing my stretches. So we're still doing stuff every day. It's just not necessarily as targeted to the ankle.
Okay. And but that was going on before you started the 42-day HealthKit journey.
Yeah.
Okay.
Yeah.
So out of curiosity then, if you were, so like for the general public who completes the HealthKit, and it was like a big deal to actually get through it, and you started to have a little bit of burnout, right? But you still did it and you got some rewards from that. Then what's next? Like, what's next for these people?
I suppose it depends on what they want to do. Like and we're huge on it. Like, what is the purpose of it? Overall, what's the playful aspect to it, right? Like, I have a bunch of movements that I want to do, and Zoe has some yoga movements that she wants to get better at. So that's the play to it. So if you're like, I feel better doing this, like, okay, pick the target, make it your aspiration. Like, what then just back engineer it. Like, what's the position like? Can I go do a different type of stretching, or can I go back through the program and do different experiments? Or like, I really want to do this, then go try it. Like, just start trialing different things and seeing what works and what resonates.
Yeah. Okay. So that's the thing, is like you start to integrate your new success, dorsiflexion, resting squat, whatever it was your goal, into your daily playful life, dancing, soccer, yoga, break dancing. For me, I want to break dance.
It's an R&B out there.
I do. I'm gonna get my hat on sideways, and I'm gonna and then when you find yourself needing extra, you can go through the program again. You can try different experiments, and it's there as a tool that we use all the time.
Well, essentially, so what you'll find is if you improve your ankle dorsiflexion, you might then have to improve your knee flexion or your hip flexion.
Yes.
And there's a different purpose that you can go back through and redo it, from the lower body down. So there's a lot that can be done there.
This is a good podcast format. It's Ruth, Zoe, and a Tom.
Yeah. Hey, I'll take
you need the Tom.
Yeah.
Everyone needs a Tom.
Yeah.
Okay, my friends. Thank you so much. And
Thanks,
I really appreciate the time, and I really look forward to chatting with you again.
Thank you,
Ciao.
Ruth. Lovely to meet you.
You too. Bye-bye.
Have a good
See
day.
you.
Bye.
You too. Bye.
Night.